Welcome back to the channel. I am the Pineal Cyst chick, and today I'm going to be talking to you all about my surgery. Well, actually surgeries, because there was 2 of them, and we'll talk more about that in a minute. But first, I want to give a quick disclaimer. Like always, I'm not a doctor. Please don't consider anything that I say as medical advice. This is simply me sharing my personal experience with you, hoping that it can be of some benefit to someone else that may be navigating this journey. My pineal cyst surgery, also known as a pineal cyst resection, took place at the Medical University of South Carolina. I did that back on March the 28th, and then a subsequent surgery on the 30th. My surgeon was Sunil Patel, and I did a great deal of research about him before I sought him out to do my surgery, and I encourage anyone to do the same thing. If you are looking at this, do the research, ask the questions, dig online. There's lots of free information that's available. I also recommend checking out the support group that I linked in the description. It's a great place to talk to other people who have gone through this and are going through this experience. And I also have some articles down below for you to take a look at. And anything that I speak about in this video, I will be referencing it in the description. So anyway, my surgery did take place at MUSC in South Carolina. I scheduled a consultation with the physician's assistant, and it took 4 weeks from the time I saw him that I was contacted and spoke with the surgeon directly. Because I was out of state, I had to do it that way. Normally, they like you to actually meet in person prior to agreeing to surgery, but that just wasn't possible. So 4 weeks to get in to see the physician's assistant, 3 or 4 weeks before I spoke with my surgeon, and then another 3 weeks after that before my actual surgery procedure. So I didn't have a ton of time from the time I knew when my surgery was to actually make my arrangements, such as where we were going to stay. But we did manage to work that out. There was a run that takes place in South Carolina during that time, the Cooper River Bridge Run, and there's also a big tennis event that was taking place. So with only 3 weeks, I did find a place. I stayed at the Home to Suite by Hilton, and it was about 20 minutes away from the actual hospital. It was in Daniels Island, and I tolerated the trip well. Some people do not travel well after their surgery. However, it was okay for me, so that wasn't really a deal breaker or anything that caused any huge problems for me. I went down on a Saturday. We arrived Saturday afternoon, kind of got moved in. Sunday, we did a little grocery shopping, rested, and then that night I took a shower and washed my hair. They just asked that I use Dial antibacterial soap, so nothing really fancy about that. I put my hair half up, half down. As you can see, I have pretty short hair. So, and that was it. I had surgery first thing Monday morning, and the procedure took about 2 hours. They made about a 4-inch incision right in the back of my head, and I'll insert some pictures here. After that, they used microsection to go about attempting to go in and get this cyst. Now, when I went down, typically this surgeon, he uses the images, the MRI images that come with the patient that they took before they arrive for their surgery. Many of the patients that see Dr. Patel are from out of state, all over the country. He's highly sought out, and it's with good reason. I had a wonderful experience with him. So with that being said, the MRI scans that I had happened to not be detailed enough for my surgery. It turned out that he was not able to access the cyst from the approach that he was using based on the MRI images that he had. Once my surgeon had actually gotten inside of my skull and was attempting to resect the cyst, there was actually obstruction by my occipital lobe a portion of my brain that was kind of in the way. So based on my anatomy, which just happened to be different, the place where my surgeon attempted to reach the cyst was not possible. So in my subsequent surgery, the incision was made a bit higher and curved over to the right just a little bit, and he was able to successfully fully remove the cyst from that approach. And I have a lot of respect for him, and I'm not upset about that at all, because I think it takes a lot of humbleness and wisdom to know that if something's not what you anticipated, which I think happens a lot in surgery and medical procedures, you have to be ready to make a change in direction. And so what we did is he closed me up, and we agreed that we'd proceed with surgery again 2 days later. So that night, around 10 o'clock at night, I did have another MRI at MUSC, and that was probably the most pain that I experienced. And fortunately, most people won't have to go through this, because I had to have a subsequent procedure, and the staples were right on the MRI table. So that was about 30 minutes, and it was pretty uncomfortable. But it was necessary, and on Wednesday, when we had the procedure for the second attempt, this time everything went great. He was successful in removing all of the cyst, and the better MRI scans that were more detailed that he required assisted him in doing a great job. So I have no complaints about that, and I know that most people's situation will not be the same as mine, but that's what happened, and that's maybe the only not perfect thing, but again, I'm perfectly happy with the result. So anyway, when I woke up from both of the surgeries, the pain was manageable. I wasn't miserable, crying, screaming, dying. It wasn't that bad, and that's actually what I was most afraid of. I was able to get up and walk to the bathroom. I had assistance. I didn't walk with a walker at that time in the hospital. I was able to get to the bathroom by kind of walking down the edge of the bed, taking a handhold, and then I was fine. So that went perfectly okay. I did ice a lot. I used my little beanie hat and I put ice inside, and I did that quite frequently, which helped a lot with my pain. The staff and everyone there was wonderful. I met the sweetest, most nicest nurses ever. My anesthesiologists were great. Everyone was super compassionate and encouraging and nice, and I just can't say enough good things about my experience there. So my procedure, my surgery was closed. The first one with staples, because he knew he was going to have to go back in, so didn't really stress it being super pretty. However, after the second surgery, my incision was closed up beautifully. My incision continues to heal beautifully, and I'll insert a clip of that right here. So both of the procedures took just about 2 hours. My husband was allowed to stay with me at the hospital, and this is March of 2022. MUSC had lifted restrictions about how many people could be in the hospital, how many visitors, things like that. So that was really nice. I had his support, and he was wonderful throughout the whole thing. I would say one thing: if I could do it again at the hospital, I would have maybe put a note on the door to ask maybe for a reminder that people close the door gently, because some very nice people, like the folks that brought in our food, or like the housekeeping staff that were so nice, but I don't think that they were always really remembering that the door was gonna push behind them, and I was very sensitive to sound. My husband's shoes squeaking on the floor made me cringe. So that was something that bothered me. If I could do it again, I'd maybe put a note up about that. That's something you could maybe think about, something nice like brain healing in progress. Please close door gently. Just a suggestion. I had pain in my jaw. I think I had a little bit of TMJ trouble before my surgery, but definitely after having my mouth open for the period of time for my surgery, I definitely was very sore. Eating, I could only open my mouth just a bit at first. I also think this is something that's isolated mostly to myself. I hadn't heard other people talking about this, and again, I had 2 procedures, so I think that may be why that was extra bad. So that's just simply my experience, may not be true for anybody else. Let's see, so first surgery was on a Monday, the second one was on a Wednesday, and I went back to the hotel, discharged from the hospital on Friday. So things went really smoothly as far as I'm concerned. Again, the pain management was adequate. I did have a couple of IV injections, but I wasn't like on a constant IV drip or anything like that. All of my medications were oral, which was good because they did a good job transitioning me, getting ready to go back to being at the hotel. So that went very well. On about day 4, I could wash my hair. I think like day 2 or 3, I could take a shower. I just couldn't scrub, which was fine. And once we were at the hotel, I tried to walk daily. I don't think the first day I did, but every other day after that, I got up. I did use a walker because I wasn't necessarily unsteady. I guess sometimes I was a little bit unsteady. I could have made it just fine, I think, without it. But for my husband to be like opening doors, carrying a tray, maybe carrying my water or other stuff, it was nice that he could focus on that and he didn't have to be like standing right next to me because he was kind of, I think everybody's loved ones are going to be kind of anxious about making sure that you're safe. So the walker was nice for me. It's not an absolute. Like I said, I think I would have done fine without it, but it was nice to have just for stability. And also I kind of like that as I was walking around, it gives a little bubble around you that people realize there is something going on with you. And I was kind of afraid about tripping, someone bumping me falling or bopping my head on something, which all probably was very unlikely to happen, but still was something that I was keeping in mind. So when we went outdoors for like a longer walk, which I did do, I walked around the hotel, I walked around outdoors. The hotel was an extended stay place, so we had a little stovetop in there. It was very spacious and nice. I will insert some pictures of the hotel here. So I've almost hit the 3-week mark and I want to show you how my incision is looking. My hair is growing in great, so let's take a quick look. My hair is down. You really don't notice. If you have long hair, you definitely won't notice. But if I pull my hair apart, you can get a look there. So it's really not that bad. It's growing in really quickly. And so if you're somebody getting ready for this surgery and you're worried about your hair, don't worry about your hair. It's not a big deal. It grows back. So I did do daily walking. I was very vigilant about making sure that I was staying hydrated so that my gut would move, which it did. I didn't have any huge problems with constipation or anything like that. I was taking Miralax as a stool softener. So overall, the transition from the hospital to the hotel went very well. I did use a shower chair, and it felt so great. The first shower I took, it was wonderful. And having the shower chair in there just allowed me to stay in there a nice long time and just enjoy the warm water over my muscles, like on my shoulders and my back. I was a little bit itchy just from, electrodes being stuck to me and things like that. So it was so nice. So a shower chair or someplace to sit is not a must-have, but it really was really nice. I guess one other thing I wanted to mention was the ride home from actually like leaving the hospital back to where I live. So it was a 6-hour, almost 7-hour trip, and I tolerated it pretty good. I did use my Infinity travel pillow that I was talking about in my must-have video, and if you haven't seen that, that'll also be in the description. But I did okay. I iced, I used my pillow, we made a few breaks along the way. I wasn't miserable, but I know some people really are. They still have problems with nausea. I was discharged with Zofran, and it was super helpful. And so I guess that's pretty much it. The pain was mostly just kind of whole head pressure. Think like horrible sinus infection headache pain, but like worse than sinus, of course. And of course my jaw pain, and that's about it. So I'm not saying it was a walk in the park, not a chance. And if you check out some of the other videos here, I have a 3-day update, 5-day update, but here I am almost on week 3. I'm approaching the 3-week mark, and I feel better than I did before my surgery. And the next video that we'll be recording is all about my symptoms, and so I'll tell you more about what I was experiencing and what's so much better now. I guess, so for now, I am off of all prescription medications. I only take a couple Tylenol now and then, maybe once or twice a day, depending on what's going on. And, I guess the biggest thing now at home is fatigue. So your brain goes through an awful lot. It's kind of traumatic, and it needs to heal. And so since I've been home, I find that, my energy is increasing, but that is the one thing that if I go on an outing, I come home and I'm ready to zonk out for a few hours. But that's okay. I've given myself permission to, accept what the recovery looks like, and from what I understand, it may be 6 weeks, 8 weeks. I know there are some people that have been back to work in 6 weeks. I think 8 weeks is probably more likely. Some people it takes 3-4 months or more. I'm feeling really good about how things are going and being careful not to push it, but I'm hoping I'm on the shorter end of the spectrum so I can get back to my life. So anyway, I hope that this video is helpful for someone that is looking for information about this and having trouble finding it. This has just been my personal experience. Overall, I feel like it's gone almost as great as it possibly could have. If you have questions, if there's something you would like me to go in further detail about, please put it in the comments. And I'd really like to know why you're watching this video. Did you find me by accident? Did you search for me because you're going through this? Are you a caregiver to somebody who is going through this situation? I'm really curious, and I literally am only creating these videos for the fact that I want to be helpful to somebody else, because it doesn't have to be so difficult, and we can help each other. So if I have good information that I can share with you, I'm hoping that I can help somebody. If I make anybody's story a little bit easier to navigate, that's all I'm really wanting. So thanks a lot, and be sure to check out some of the other videos. And if you do like and subscribe, it does help me get this information to more people that are actually looking for it. So thanks again. I appreciate it, and you guys have a great day. Until the next video, stay healthy and well. I'll see you in the next one. All right. Bye-bye.